how good your data is will also affect, in a sense, the kind of models and forecasts you eventually come out with. So the
So
data
just
is very important in this, and that is why this is a key issue in DOH. The data is becoming problematic as the time passes. It wasn't so hard for us to understand this pandemic in April, but now the data is problematic on many fronts. No, there are aspects of the data that are not part of the database run because they're not yet validated. And then we're seeing this new phenomena, guys, and I hope that we say it now in your show again. Nauna na naman kayo. We're seeing this problem of uncategorized cases.
yes, I was going to
Imagine this,
ask you, what are those?
Okay, great. That's a good question. These are
Uncategorized.
positive cases, huh? Luchi, these are
Yes.
positive cases already. But for some reason, the database does not indicate where they're located. So imagine you want to study Cebu, you want to study NCR. Now you have 2,000 of these cases. How can you make a model now? Because you can't guess where this data is located. So
So
DOH
it's not
has
the
the
location
primary
of
responsibility for cleaning that up. Otherwise, you won't see us next week here or the week after, because it will be hard for us to find to make credible models if data is not complete, it's not accurate, it's not accessible. And I know a part of being a researcher is to clean up data, and that's what we were doing yung team namin, no? When we get the data, we don't expect it to be perfect, so we clean it up. But right now, we're having problems with the accuracy of the data now. And it's become a big issue. I don't know how. If we can't forecast, I don't know what DOH is providing as far as input and information for the national government. That's my basic position. If we don't solve this, we're not just going to have problems with modeling. We're going to have problems with the way we're going to run our strategy on the ground. Alam mo yun? Because contact tracing will be
Oh,
affected. We don't
yes.
have these, yeah, ang daming maapektuhan eh. Hindi lang yung aming picture of the pandemic, which we love to do every week. It's really the whole strategy. If we don't have good data is the basis for good policies. And
But how did
I
you
think we need to
determine?
work on that. It's very
How
basic,
did
I
you
know.
how did you determine that there are uncategorized cases? How did
Yes,
you
in the
determine that?
report. Yeah.
Yeah.
Yes,
Kids,
in the database of the Department of Health, they are actually labeled. It indicates what region they are from, what LGU, for example, if they have that information. But right now there are about 2,500 cases which don't have yung region indicated, or even LGU. So we're not sure if they're part of repatriates, because there are 1,200 repatriates in the database. So
Yeah,
we
but
can we can count them, but these are not. We're not. It's not clear if they are repatriates or if they belong in NCR or Cebu. So
yeah, but
we
Professor, generating the data, generating the research is an ecosystem in itself. I imagine you also know how it's carried out from the ground until it's processed by agencies, until it's made available to researchers like you. What do you suspect is happening on the ground, and in the transmission of the data? What do you think is taking place on a human level?
well, for one thing, when you get tested, and we have improved testing by 10 times no over the last month. So we're testing more people now than ever before, but we're not testing enough pa rin. Okay, that's the first thing. Now, all those tests on a daily basis, assuming they're 10,000 a day, go to laboratories. Laboratories then process this, and if they find out they're positive, they write down the name, Robbie, for example, Robbie Alampay from Quezon City, and then they give it to DOH. DOH validates it. Now, that's well and good. It's okay. That part, and if DOH it takes a long time for them to do it, and DOH takes a long time to validate, we're fine with that because we know where Robbie Alampay resides, and we can use that as strategic information or to create data for strategic information through our models. Right now, we're having a problem. What's listed down is Robbie Alampay only.
Yeah, but
Period. So
that's
there's
my question.
something
That's
wrong
my
in the
question. Yeah,
database.
Yeah.
yeah, obviously. But that's my
Okay.
question.
Now,
What do you think is
we're
triggered when something as basic
yeah.
as
Yes,
where
I
I live
know.
gets
I'm
knocked
getting
from the
there.
reporting? What? Okay.
Apparently, DOH, we're working with DOH. We're partners with DOH. All of us are working together to find a way to bring down transmission. So, they're telling us the laboratory is not filling up the proper information. So now they have to call these laboratories one by one for all of this. I know it
Yeah.
can be, managed, no, at some level. They have a new information system, COVID Kaya, and I think we can encourage, no, exhort our laboratories to be more, accurate in transmitting data. It's also important that LGUs transmit data that's both validated and, cleaned up to DOH. In a timely fashion, not 4 or 5 days, but less than that. So it's a lot of it has to do with human capacity, the personnel involved. A lot of it has to do with the information system that everyone is using. We're really hoping and praying that we can get this fixed up because we had one problem with unvalidated cases, and we can understand that because we were starting in March unprepared. Now they were fixing it up, so there was some backlog. But now we have this big problem of uncategorized, and we have a new system. We're really hoping it kicks in. But if not,
Uh,
then we don't have a complete picture of where the pandemic is, how it's spreading, and that's critical information for the ground operations. As far as USEC Densing was just with you a while ago. The national strategy is cascaded to the local government. Your barangay is the front line, is the basic army against COVID in your community. So they need good information, and hopefully DOH will solve this. We're hopeful.
In fairness to the DOH, they have repeatedly said that it's the disparities happen in the lab during the testing, the lack of training perhaps on the process of testing, and so on and so forth. No, so I rather think that there's no malice in holding back information as crucial as location. But to be more direct, Professor Ranjit, what do you think about the recommendations already made by the IATF in terms of imposing the quarantines? Do they square with your findings and your
Yes, actually, yeah, they do. I echo your position, Lucci, and maybe Robbie. That's how I would like to think about it. That this is a continuing challenge, and a country with an information system such as ours is totally unprepared for a pandemic like this. And I think most countries are grappling with this. But then again, while that is true, data is important, and we need to solve this problem as soon as possible. Because if we're going to help each other, the academe, DOH, and government and the private, we need good information. And the private sector, by the way, needs good information for their business planning. So, and it will also strengthen the legitimacy, of DOH as an institution. I think they're serious about it, naman.